This is the Psychedelic Medicine Podcast.
Hello and welcome to the next episode of the Psychedelic Medicine Podcast. I'm Dr. Lynn Marie Morsky, your guide on this journey, and today we'll be discussing medical literature regarding psychedelics and pregnancy with Dr. Ben Malcolm. Dr. Malcolm is a psychopharmacology consultant, psychedelic educator, and founder of Spirit Pharmacist, LLC. Side note, Dr. Ben Malcolm is also a board member of the Psychedelic Medicine Association, so I am very grateful to him and all of his work. Ben is on here because he recently wrote an article for his website on what has been shown, what he was able to find in the medical literature regarding psychedelics, pregnancy, breastfeeding, and all of those things. Now, Ben, before we get started, let's talk a little bit about the fact that, first off, there isn't a lot of literature, but that, you may have gotten a little, I know you published it and you got a lot of people appreciating it and then a little bit of pushback. And so if we could talk a little bit about, what led you to write this article and some of your thoughts around it.
Yeah, so what led me to write the article is that people have questions about this. Like I've been getting questions about this for a number of years, really, and it's just something that's quite interesting. Postpartum depression is also like an area that's really like underserved, undertreated. The standard options maybe don't work very well, or the standard options have different risks in that kind of circumstance compared to other sorts of circumstances. So I thought that it would be a good time just to kind of go through and see what is actually out there as far as medical literature, and what could be put together or what could be written that would help a person potentially understand what kinds of risks they could be taking. And like you said, it's not an area where there's high quality data. There's some obvious ethical reasons that makes the study of drugs much harder in pregnancy and nursing compared to other sorts of populations. So it is an area that tends to lag behind the rest of medicine generally. And if we're talking about psychedelics that, beyond ketamine aren't even FDA approved yet, then it's the kind of thing that if a woman is having questions about that, or seeking information about psychedelics in pregnancy or nursing, it's also an area where she's likely to face a lot of like stigma or judgment or thoughts that she could even be unfit to be a mother for wanting to kind of go down that path or avenue. But the pushback I got wasn't necessarily about anything related to what I actually wrote. It was more about like me as a writer, because I am trained as a clinical psychiatric pharmacist. I'm not an expert in maternal health, pregnancy, nursing, or breastfeeding. Um, so yeah, I have some sort of training and education in psychotropic or psychiatric medications, and part of that is special populations, including pregnancy or nursing. But yeah, it's not something that I live and breathe and do all day long, all the time. Where there are medical specialties where that kind of like is their niche. So it was particularly from the persons in that kind of specialty area of niche that thought that maybe they should have been a medical editor, or they should have, been involved in writing it somehow. But I was soliciting feedback on the article, and what I didn't get was a lot of critical feedback about data that I missed, or points that were kind of butchered, or things that would put a person in harm's way. So from that perspective, I was actually really happy with how it turned out, at least so far.
Yeah, well, I like that. And this is a great time because I blew through it in the intro, totally forgot, probably the first time ever, and comically in the area that we need it the most. The Psychedelic Medicine Podcast is for educational and informational purposes only. Nothing here is to be construed as medical or legal advice. Perfect timing based on that, because you're right. A lot of times in the article, you specifically say, like, I am not saying this is okay to do. I am just telling you what the literature has found, which is why we even titled this medical literature regarding, because this is not advice. This is just a little, like, you have done the work that is not easy. I think a lot of people have, as you said, a lot of people wrote to you saying, I've tried a deep dive to find this kind of thing, and it's not that easy to find what little literature out there that there is on this. So I very much appreciate that you put yourself out there, that you went ahead and did it. And for anybody listening, at the bottom of this article, which we will link in the show notes, you can find it at spiritpharmacist.com, I'm assuming, Ben, correct?
Yep, spiritpharmacist.com/blog. It's the first hit you see on that page. Yeah.
Perfect. We will link that. And then at the bottom, as Ben said, there is a solicitation, his email. It says, write if you have any additional information, because this is, I was just telling Ben, I was at South by Southwest. There was an entire panel on women in psychedelics, and most of the answers are, we still don't know. And so if you happen to know, or if you happen to be looking to do this kind of research, please step up and do it. We'll be very excited. There are so many questions that need answering in this arena. So Ben, I'm going to kind of follow the outline from your article. And let's start by asking, why would you consider psychedelic use in pregnancy or while breastfeeding?
Yeah. Well, I think because persons that are pregnant or breastfeeding oftentimes struggle with mental health related things the same way that other persons struggle. The reasons that they struggle could be a little bit different. It could be circumstantial or perhaps even like hormonal or like endocrine related, right? So there could be a somewhat different sort of etiology. But I'm thinking, particularly in the postpartum period, like particularly when a woman is nursing, if they are experiencing postpartum depression, that has real consequences for the care of the infant, their ability to bond with the infant. And oftentimes there's an awareness around this, like, I'm not feeling well, I'm not able to bond or interact or play or take care of this child the way I want, and then it just feeds back onto the mental state. So it's an area that inherently, I would say, doesn't have many options or many good options. There is one progesterone analog that has been approved for postpartum depression, but it's administered as a 60-hour inpatient infusion. So that literally means for 2.5 days, there's a line inserted, and it's going to be done in kind of an inpatient kind of setting. So, I mean, if it worked, if it really lifted postpartum depression, perhaps, but it seems mildly efficacious overall. And I'm just thinking the logistics of administering a 60-hour infusion, being hospitalized for that long, having to have the infusion done for that period of time would probably limit the ability to interact or care for the infant or baby in of itself. You can look at things like the serotonin reuptake inhibiting antidepressants, and they have been studied in pregnancy and nursing, or pregnancy and nursing, on a case by case basis. Some people do find some benefit there. It's a controversial sort of area. There's some data suggesting that antidepressant use could raise or increase the risks of autism. There's also data supporting that depression itself increases the risk of autism if the mother is depressed during pregnancy. So I don't know. There's a lot of discussion around ancestral trauma, adverse childhood experiences, what happens in utero. I mean, Stanislav Grof has a whole perinatal matrix assembled, around psychedelic use. So it does seem like an area, because of the potent and rapid, robust sorts of antidepressant benefits that we've seen from psychedelics in other trials. They're intermittent rather than opposed to chronic nature of use. And for certain psychedelics, even their ability to increase social bonding neuropeptides, things like oxytocin. There's maybe even a thought that psychedelics would help a mother attune to their child better or feel more connected in some way. So basically, because there's a dearth of great options right now, and it seems that psychedelics are sort of poised to be breakthrough agents in other areas of treatment resistant mental health, and they have this kind of intermittent nature of use. It seems like there could be some potential advantages for that kind of circumstance or setting, at least in theory. Yeah.
Yeah, absolutely. That leads us into the question of, can fetuses or newborns be exposed to psychedelics if the mother ingests them while she is pregnant or breastfeeding?
Most likely so. Um, to cross a placental barrier or get into a milk supply, a drug either has to be transported across or it has to be lipophilic or fat soluble enough to penetrate whatever barriers between it. And the placental barrier is almost similar to the blood-brain barrier in some sorts of ways, in that, there's sort of tight junctions across a cell membrane, or I'm butchering that. But what I'm saying is that psychoactive drugs or psychotropic drugs typically end up in breast milk more than other types of substances because they're usually more fat soluble. Usually, to get into brain tissue, they have to be a little more fat soluble than drugs that act in the periphery. So you're kind of looking at things like molecular size. Yep, they're small enough to, they're fat soluble enough to, and you can find, I'll say, more like preclinical models, like rodent models and things, particularly for like designer amphetamines, things like MDMA, where it clearly shows it does cross the placental barrier. So I'll say for some of the tryptamine psychedelics, there's not a whole lot of great literature definitively demonstrating, but the articles that I came across that were talking about the properties of molecules that end up in breast milk or being able to traverse placental barriers seem to really kind of match up with the properties of psychedelics. And I did find one review article actually that's really discussing the potential of psilocybin assisted therapy, particularly in nursing. And they also laid out their sort of rationale argument why they felt that psilocin would end up in breast milk.
Understood. Can we talk a little bit about neurodevelopment and psychedelics?
Yeah, I mean, psychedelics, like part of the reason that we're excited about them is that they seem to have a neuroplastic or a psychoplastogen type of effect, and it's most well studied that psychedelics can promote neurogenesis or dendritogenesis in areas of the cortex. In adults, and this is like part of the neuroplasticity, or in with MDMA or MDMA assisted therapy. Excuse me, they've noticed that MDMA is able to open what they refer to as neurodevelopmental critical periods. It also seems just subjectively with a psychedelic experience, a person oftentimes psychologically regresses to a time that they were maybe in their teenage years. But depending on how deep the experience is, it is possible that people regress to memories earlier in their life, in their childhood years. And you will meet plenty of people that feel that they have like almost re-experienced the moment of birth itself, or re-experienced certain memories that were pre-verbal. Meet certain people that feel like they have ancestral memories, right? So it's sort of like don't have a lot of like hard data around like remembering the time you're born or ancestral memories and things like that, but I really do think they psychologically regress persons, increase neuroplasticity, maybe open neurodevelopmental sorts of states that were present younger in life when we were more sponge-like as far as unlearning or relearning certain things. And I think that's it, is like I actually haven't really looked into what we know about the brain states of children overall, but I do know that we call them sponges for a reason. Like they really soak up so much and they learn their behavior from what they're observing and how they're interacting with other adults or how they're seeing adults act and things of that nature. So you would, you know, put $1,000 that they're kind of in a neuroplastic sort of state, or that their brain has some of these perhaps biological mechanisms that psychedelics could activate kind of active already. Um, a fetus's developing brain, I mean, geez, that's probably like a whole nother ball of wax. And I think that's probably, we're getting to the zone where I should just say, I don't really know, Lynn Marie, because it's just sort of not something that I've really looked too deeply into. And maybe there is more out there about brain development and things like that. And I think that that's part of this blog article, is I really focused on what can I find in a human being, right?
Yeah.
But there is lots of reproductive neurodevelopment toxicology literature looking at psychedelics in baby monkeys, baby rabbits, baby rats, and things like that. And so there probably is some bench researcher out there that's much more familiar with the preclinical or animal model of psychedelics that would be, if you're listening, please email me. Right. So we can kind of like team up on this sort of like aspect of it, because there's probably um, a lot that a person could synthesize or hypothesize from that kind of body of literature. And that is not really the flavor or direction that I took this article in at all.
Yeah, I understand. And I was seeing in here, and this may be what you were referring to. You said data is demonstrating that endogenous NN-DMT may play a role in pregnancy and development. Is that something that was seen in the animal models?
Well, I think it's just something that's like, what is the, like, why do we have endogenous DMT? What is the role of it? It kind of seems that maybe DMT is like something that's released closely at the time of death, and maybe there's something about near death experiences and the kind of going through a tunnel kind of experience that persons are having that is somehow mediated by DMT. And it seems like high dose vaporized DMT, oftentimes people see sort of a tunnel or portal and they go through it and enter another kind of dimension. So, I would say that it's in the realm of perhaps psychedelic myth, or maybe just speculative and interesting ideas would be a better way of saying it. Is that okay? Like, what is the chemical constellation of things that bring us into the world or exit us from the world? Are they actually rather similar at those different places? I personally don't know the answers to this, but it is clear that we do have endogenously produced DMT. you know Biology, like the golden rule, is always like structure determines function type of thing. So it's like, if it's there, if it's present, if it's structurally present, then I'm guessing it has a real function, right? It's playing a role. It's obvious that psychedelics induce this like neuroplastic kind of effect. So could it be that growing up, neurodevelopment involves kind of pulses of this kind of stuff at certain points? I don't know if you remember being like, I have a 5-year-old daughter, right? But I remember like being young and you have your cars, right? And you're like, and the car's like, I mean, it's going. Like when it jumps off the ramp, like it literally, it's jumping off the ramp. It's not just like a car that you're playing with, right? So they have the ability with their minds, with their imaginations, to make, what an adult sees is inanimate, like to life, to real, like type of thing. So, I don't know if that means that like being a child is like being perpetually on LSD or something like that. I've heard people talk about with LSD. They talk about a phenomenon called baby eyes. And it's like, if you're looking at your hand or something, and it's like the first time you've actually seen your hand. I don't know if you've ever had an experience
Oh,
like this, where you're like
interesting.
looking at
Yeah.
some part of your body and you're like, I don't think I've ever actually observed what this really looks like. And it's like the first time that you're witnessing it, like exploring your own being or self or body
Yeah.
from a place of, it's like I've seen this a million times, but it's like I'm recognizing it as something new with features I've never observed before and things like that. um, so yeah, I think it's probably fair to say that endogenous psychedelics play some role in neurodevelopment. They may have role in pregnancy or birth or death processes, but I don't know. We don't know. Like,
Yeah,
yeah,
to be determined,
yeah.
hopefully, at some point. Let's talk now about one of the most interesting parts of the article for me personally: ayahuasca and mushrooms, ritual use of DMT and psilocybin in pregnancy.
Yeah. So I mean, if you were going to sort of look for some kind of, I don't know, I don't even know if I want to say like the best information, but I would say like you should probably include the anthropologic record in this kind of search. And I did a PubMed search, I did a medical literature search, but persons like Bia Labat, she runs like the Chacruna Institute. She's done a lot of, I would say, like scholarship, going to places in the Amazon, talking with persons that have used ayahuasca, including persons in pregnancy. She has an article in medical literature about ayahuasca and pregnancy. And basically, the conclusion is that, well, we can definitely find that persons have done this. We can't really find that they're reporting, you know bad outcomes, limb malformations, teratogens, some kinds of illnesses. Like neurodevelopmentally, the kids seem, normal. Um, so I think, yeah, again, it's like, well, I don't know if that proves that ayahuasca or psilocybin mushrooms are safe for pregnancy or for nursing, but just the fact that it has been done and there isn't really much that a person like an anthropologist or maybe an ethnopharmacologist, I don't know what BF prefers, but to go and sort of like, okay, I can't find the harms. It sort of seems that perhaps if there was a tradition of use of ayahuasca in pregnancy or nursing, or mushrooms of pregnancy and nursing, and it really wasn't going well, then the tradition might be that you kind of avoid those things.
Yeah.
On the flip side, I do think that there are some perhaps superstitious types of traditions out there. Like I know some ayahuasca circles that do not allow women to come and sit and drink ayahuasca if they're menstruating. And to me, I can't really understand what the true biological basis of that kind of exclusion would be. Um, so yeah.
I was just having this conversation 2 days ago with one of the Johns Hopkins researchers, and we were talking about the dearth of evidence on what part of a woman's cycle is most advantageous to do a psychedelic. Is it pre-ovulation? Is it post-ovulation? And that what had started me thinking about that was the fact that certain lineages don't allow menstruating women to take ayahuasca. And very often, as you were suggesting that when things are done over thousands of years, I would assume that whatever the current practice is based on observations over those thousands of years. So
Right.
was it that they were observing for the first 1,000 years that, wow, menstruating women seem to have really difficult trips, or it sets off something else? Or was it more of a misogynistic play or something? It was hard
Right.
to
Yeah.
tell from that, but I would love to know, because you're absolutely right. That's the one distinct, seemingly menstrual based guideline that I've ever seen across the psychedelic sphere. So
Yeah.
again, if somebody wants to do research, please do. Very much encourage research in this area. Moving on from ayahuasca and psilocybin, how about MDMA? Some of the pregnancy and developmental outcomes regarding MDMA.
Oh, well, I would say like MDMA, like first of all, amphetamines definitely concentrate in breast milk. And we definitely know they are not good for developing fetuses or newborns to have it within milk supplies. So I would say like what what medicine or Western medicine does know is that amphetamines aren't really good for pregnancy, nursing, that kind of scenario. So MDMA, methylene dioxy, methamphetamine, there's some different pharmacology to it. It releases serotonin more than dopamine and norepinephrine, right? So I don't necessarily want to equate MDMA and amphetamine in this kind of conversation, but there are similarities between them too, particularly when it comes to like lipophilicity. Like, for example, could it actually make it across the placenta into breast milk? Yeah, sure. Like, sure. Um, the observational studies that are out there show pretty bad sorts of outcomes, like neurodevelopmental delays or things like that, like lagging behind their peers. But it's just heavily confounded in just poor methodology and study design too. It's kind of like you're looking at it and it's like, well, these kids had some kind of bad outcomes. It was persistent even after like 2 years after birth, like something like that. From a neurocognitive perspective, they were behind their peers. But you kind of look at, okay, what are they measuring? Is it MDMA use in pregnancy? Is it MDMA assisted therapy use in pregnancy? Like, no, it's like ecstasy. And it's not just ecstasy, it's heavy use of ecstasy, like 50 to 80 administrations, right?
Wow.
Like in that period of time. And they're drinking alcohol and they're smoking cigarettes. And, so it's sort of like, okay, I believe that they did some effort to control for these kind of confounding things, but I think that it's sort of a hard sell to me to sort of think that that data is representative of the risks of MDMA assisted therapy in pregnancy or nursing. That said, again, like as a caveat, is like I do think MDMA has higher risks than other psychedelics because it's a designer sort of amphetamine substance. Particularly in pregnancy, I don't really think that it would be a wise choice, perhaps. Um, Whereas nursing, breastfeeding, I don't know, maybe depends on how old the infant is, how robust the milk supply is, whether they're on formula, whether they can pump and dump or freeze a supply for some period ahead of time. Like in the nursing period, I think that there's more potential to use psychedelics safely and without really taking much risk as far as exposing the fetus. Whereas in pregnancy, you just don't really have that choice. Like the fetus is going to be exposed. And again, I'm not a maternal health expert, and I do know that certain drugs can be more toxic in certain phases of pregnancy than others. But what I sort of like learned and remembered is that the first trimester, when all of the critical organs are developing and things like that, is typically a time where you would really want to avoid teratogenic types of things. Not that MDMA causes malformations or is teratogenic, but come on. We know it has some level of neurotoxicity to it. We know it's a designer amphetamine. We know it's lipophilic. It could cross placental barriers and reach breast milk, right? So for a few reasons, you know, half including those heavily confounded ecstasy studies in our sort of thought process. But overall, you know, even if you were just going to completely toss that heavy ecstasy use data sort of like out the window, there's probably some other reasons to suspect MDMA has higher risks than other psychedelics.
Yeah, that makes sense. Can you tell the people, if they are not familiar with the word, what teratogen means?
Well, teratogen just means that it basically causes limb malformations or disruptions to like DNA structure that really sort of cause birth defects, essentially, right? Versus what I was like, I think I kind of slipped up and sort of introduced the term teratogen into that conversation around MDMA where it really didn't belong there overall. Whereas what I was kind of like saying with the studies that have been done, it's more like neurocognitive sorts of problems where they're behind their peers. And I think I even said like neurodevelopment or developmental delay, which is actually more like, you know, the newer term for like mental retardation. So it was like what actually wasn't those kind of outcomes that they're observing. It was more like neurocognitive problems, like they don't learn as fast, like they don't crawl as fast, they don't, like they're just kind of behind, is sort of what I glean from reading it.
Yeah. I'm gonna insert a question here that is not in your paper, and the answer is probably like doubly no because it's two things we know very little about. But maybe you see where this is going. The question I get is microdosing safe in breastfeeding? Because we were talking about, like you were talking about, breastfeeding is generally easier because you can pump it up or save a supply, and that's usually if they're going to do a one-time journey. But
Mhm.
microdosing being more of a continual thing, what are your thoughts on that?
I, you know, more than like doubly no, I just think we don't know would be like
Yeah,
more like
that's
my
what I
response.
meant.
Isn't it
Doubly,
like
we yeah.
it's like really like tiny doses and how much is actually in the milk and how old and robust is the fetus? Like this paper with psilocybin assisted therapy, this review article, it's more like a theoretical rationale for like why it could be possible, but they have some like really nice points around. Well, if you kind of look at drug use in mothers that are nursing, it really sort of seems that if the infant is healthy, robust, and you know a good 6 months old, it's fairly resilient, and that doesn't really mean that you would want to be feeding it drugs that in your milk supply that you know has some kind of like risk to them or things like that perhaps, but the chances of it really producing some level of harm go down at that point. um,
Just to
so
clarify,
yeah,
I
I don't
didn't
know,
say.
it's like it's all, yeah, go
I
ahead,
was
go
gonna
ahead,
say I
go ahead.
didn't say doubly no. I meant doubly we don't know because we don't know about
Oh, go.
psychedelics in pregnancy and we don't know about
Yeah,
microdosing, like if it even works. So there's like two, I mean, things that are still very
yeah,
much under researched. So combining
yeah,
them, it's a whole lot of unknowns.
yeah, yeah. It's really tough, you know, it's like really tough, like you can't come up here and like say anything about like, oh, microdosing is safe or this and that, but everything is a risk versus benefit decision, right? And okay, well, I mentioned SSRIs and there are some potential risks to those types of things. I mean, those are just the risks I talked about, not to mention the kind of side effects they could have, the other drug interaction potential they could have, like things like that. Like, I mean, I literally just talked about a one risk, right? So yeah, other options have risks to them. So that usually creates this sort of default perspective of just don't do it, just don't do anything. But then we know that having a mother that is feeling unwell, or a mother that's expecting that's feeling unwell, is also not good. Like, it's not good for the infant. There is some risk in doing nothing, like omitting care has risk to it. Then you have an intervention like microdosing, where the risks and benefits are just unclear on its face, like overall. So I would say that it becomes like a really highly personalized kind of decision, and maybe depends on what kind of person they are overall. And like, okay, I had a baby, it's been a few months, I'm feeling kind of like down in the dumps. Should I start microdosing? Never done that before, completely psychedelic naive. I don't want to say like absolutely not, but at the same time, I might have more reservations than sort of like, yeah, I'm a little bit of a psychonaut, or at least I kind of have a spiritual community that I've been ritually ingesting mushrooms or ayahuasca with for some period of time. And I have like a pretty good feel for what psychedelics do for me and how they do help my mental state. And boy, I avoid them for the 10 months of pregnancy. I've avoided them for 3 or 4 months afterwards now. And I need a break. I'm exhausted. I'm not sleeping well. I'm stressed. I'm feel like I could do better as far as like bonding and attuning to this thing. And man, those are sort of all the properties that psilocybin or ayahuasca have offered me in the past. I wonder if it would be all right to take a small dose and see if I realize some of those benefits. You see what I'm saying? It's like you can paint these different scenarios or pictures where, yeah, again, I can't come up and be like, well, yeah, obviously for case one, no, and obviously for case two, yes, right? But you can kind of get a sense of like, oh, maybe there would be a person, a circumstance, or situation where even with unknown risks and benefits of microdosing, it's like, well, if there's known benefits of psychedelic use in their history, and or they know they don't want to do the other kinds of options, and they know they need to do something. Yeah, well, I don't know, cognitive liberty is king for me.
I like that. I like the cognitive liberty. Yeah, and thank you for laying out that scenario, because absolutely there are a lot of people suffering in these populations we're talking about, and risk benefit ratio is definitely something that should be weighed. Going back to your article, LSD, pregnancy and birth defects, is it a potential teratogen?
The current state of affairs says no, not really, right? LSD, I would say there was probably, I mean, there was a lot of stigma, and there is still a lot of stigma around LSD. But in the early '60s and '70s, there was essentially some literature that came out that said that LSD could induce chromosomal breakage, and that it was teratogenic, and that it would be predicted to lead to lymph malformations and things of that nature. They've kind of rehashed. It seems like you can go back to literature of that time and kind of look through the 60s and early 70s. And by the late 70s, it seemed like the tune of the review articles kind of all got together and were like, nah, there's not enough here. Doesn't really seem like it. That being said, I could find cases reported of like ocular malformations of infants born to mothers that ingested LSD during pregnancy. Not a smoking gun. It's a case report. I mean, it's literally an anecdote, right? But I felt that it was important to include the cases just because there was this kind of previous scary research around it being a teratogen. Um, I personally don't think that it is, and I can also see that if one paper says it's teratogen, and then you're a doctor and maybe in a labor delivery ward, something like that, and then a case comes out with some kind of malformation, and you're interviewing the mother, and there's LSD there, then it becomes very tempting to write it up, and it sort of like starts to confirm this kind of like misinformation. So I don't really know what to make of the cases. They're anecdotes. I mean, that's literally in as far as medicine goes, case reports are at the very bottom of the hierarchy of evidence, or things that we would trust if you're practicing evidence-based medicine. Uh, so, no, I don't think LSD is a teratogen. I will say that ergolines, like other types of ergoline molecules out there, LSD is an ergoline, have been used as abortifacient types of molecules. They can cause uterine contractions, and even like ergo poisoning, like St. Anthony's fire, like uterine contraction and like miscarriage was like part of like ergo or like rye fungus poisoning. So LSD, I haven't found any cases of miscarriage. I couldn't really find anything. Even, I mean, again, like who knows the animal literature? Is there animal literature demonstrating that LSD can produce uterine contractions in some other type of like preclinical way? Be interested if you know of that experiment. Um, but I'm almost like thinking like with LSD, how do you know what you're getting is LSD? It's like this microdosed type of thing. It's usually on blotter. I mean, the phenethylamine enbomes that are sometimes substituted would have, I mean, they're phenethylamine. So I would think they have almost a more MDMA-ish type of like risk profile. Or perhaps it's an LSD analog. And now we're talking about ergoline analogs, and maybe there is some kind of substitution that changes the ability for uterine contraction and things like that. So I would say like LSD itself, like pure, clean, good LSD, there's not a whole lot out there demonstrating that is really bad for infants um, or fetuses in development. But there could be some other reasons to maybe pause and really critically think about LSD use relative to those sort of indigenously based or tradition based tryptamine psychedelics
Yeah,
like
that makes sense.
psilocybin or ayahuasca. Yeah.
Yeah. Um, Moving on to another non-indigenous medicine. This is the most fascinating one for me because there is some research and it's legal. Can we talk about ketamine both in pregnancy, in prevention of postpartum depression, and also in breastfeeding?
Yeah. So in pregnancy, I haven't been able to find a whole lot, which is actually kind of shocking in some ways because it's been used as a general anesthetic for a long time. You think that they probably like there must have been a time where there was an operation or you would think that there would be something out there. I found like one preclinical article from like the early 70s or maybe late 70s that was kind of like ketamine can stimulate uterine contraction early in pregnancy. How clinically significant that is, I'm not really sure. But I think the real exciting parts about ketamine is some of the randomized double-blinded trials that have been done in women that are having C-section procedures. They've actually randomized women to ketamine for analgesia or pain control in a C-section procedure versus either placebo or some other kind of like analgesic agent. And they find that if you get ketamine during your C-section procedure, and even more strongly as a pain infusion for 48 hours after that C-section procedure, it has a protective effect on the development of postpartum depression. And I mean, this is not ketamine assisted therapy, people. This is ketamine given in a C-section operation, right? On top of that, like Phil Wolfson's group, kind of up in the North Bay area, recently put out a paper. It was a pharmacokinetic analysis. It was just 4 mothers, but it was basically looking at how much ketamine was found in breast milk after they gave them an intramuscular injection, and they found extremely low concentrations of ketamine in breast milk to the point where they were sort of like, well, we're not going to say that it's safe, but if we did our math right, it's really hard to believe that that would have any kind of real effect that would be adverse. And then even if that were true, ketamine is also a fairly short-acting psychedelic. It's more rapidly eliminated than others. So, even if you wanted to avoid giving ketamine and breast milk at times that would be at the highest concentrations, you're probably not looking at needing to avoid breastfeeding for very long to accomplish that. So, yeah, out of all the options that I kind of reviewed, I would say that, okay, from the sort of traditional perspective, there was very little I could find in the way of harms around psilocybin and ayahuasca, but there also really wasn't much I could find in the way of benefits or real use in medical settings and things like that either. Whereas ketamine truly was the winner as far as like, wow, like we have given this to women that are giving birth, and it has, in randomized double-blinded trials, demonstrated that it has this protective effect of postpartum depression. And again, it's just like raw naked neurochemical antidepressant effects of ketamine. This isn't like, okay, we have a mother struggling with postpartum depression, recovering from a C-section operation, and maybe she had a different birth plan, and it was kind of traumatic to have things switched and go to the OR at the last minute, and now I'm just feeling sort of like off a little bit, and want to get back to recovering from operation and focusing on being a mother. It's like, could we insert a session or two of ketamine assisted therapy in there and accomplish a whole lot? Again, the answer is I don't know, but I'm much more bullish on the potential of actually doing those kinds of experiments or the safety of ketamine in those kinds of settings compared to the others, just because there was just more information out there.
Yeah, absolutely. We're wrapping up. We have two things left. Can you talk a little bit about the endocrine responses to psychedelic use? If you're not familiar, listeners, endocrine is the system that controls our hormones. So, what do we know about how psychedelics may affect some of the hormones related to pregnancy and breastfeeding?
Yeah, so again, like I think this is an area where, like, yeah, exactly, like someone that was a pregnancy expert, like maybe an OBGYN or someone could like really sort of look at the sort of I would say like endocrine peaks and the endocrine cycles that are associated with pregnancy, maybe even like the event of like birth itself, and compare it to the sorts of endocrine effects of psychedelics to try to determine if there would be some risk. So, for example, like psychedelics tend to cause temporary shifts in endocrine profile. So it's usually not like a long-standing thing. It's usually more like a kind of a 24-hour sort of event. But they increase plasma concentrations of cortisol, oxytocin, prolactin, epinephrine. They tend to have more minimal effects on neurotransmitters or hormones like norepinephrine, as well as the hormones like testosterone or progesterone. So, like prolactin. Well, that's definitely the hormone that causes a woman to express breast milk. Oxytocin. This is a social bonding neuropeptide, but pitocin. I mean, that's a synthetic oxytocin that's literally given to a woman to like induce birth in like medical settings and things like that. So I would say like it's a bit of a black box to me as far as like how these endocrine effects of psychedelics would interact with pregnancy, and perhaps like specific phases of pregnancy, or whether it could give the body a signal to start a different phase of pregnancy prematurely, something like that. Like that would be my like big concern around the endocrine effects of psychedelics in pregnancy. Again, I think postpartum it's a little bit different, because it does seem like the endocrine profile of psychedelics is sort of at least subjectively geared towards bonding and sort of like feeling more attuned to the needs of others, or maybe even having like empathogenic kinds of qualities depending on the substance. So it seems like we're probably on like slightly more sturdy ground there, as far as like thinking like, okay, there's probably like a relative degree of safety, it's not as high a risk, yet there still could be a real benefit to bonding with a newborn.
Yeah, absolutely. Okay, let's round this out with set and setting in pregnancies and some of your pregnancy and breastfeeding, and then some of your overall conclusions. I think you started to give us a maybe your risk profile of what you would
Yeah.
recommend versus avoid. But yeah, let's talk set and setting into some of your final thoughts.
Yeah, so I think that's just it. It's like when we think about psychedelics, it seems like set and setting are, they're paramount to safety. They're paramount to having a good experience, or having a therapeutic or healing kind of experience. So I'm kind of thinking like, what is the set and setting of pregnancy itself, and what are we picking as far as substances, doses, routes of administration? I feel like there's a whole lot that could be said there about the ultimate risks that a person is really taking or encountering. The difference between medicine and poison is typically, dose. At least that's Paracelsus's line. Um, so yeah, I mean, is it a high risk pregnancy where you're 45 years old and have gestational diabetes and preeclampsia, and yeah, like that sounds like it's going to be higher risk than, oh yeah, this was an easy pregnancy for me. It was low risk. It was uncomplicated. Um, right. So it's sort of like different persons go through different things in pregnancy. They have different bodies. They have different ages. Right. So probably like, yeah, like how robust is the health? Right. Would be one sort of like factor. are there risks or complications to this pregnancy, or is it pretty smooth sailing? And then, yeah, okay, what are we trying to do? Are we talking about, hey, like again, back to that, well, I've been drinking ayahuasca with my spiritual community every month, every other month for the last decade or so, and I avoided during pregnancy, but now I'm kind of on the other side, and I miss ceremony, and I miss music, and I want to get back to my people, and I'm just wondering, like, maybe I could take like a quarter of my normal dose and just be in the space and sort of like bathe in that presence and soak up some of it. Okay, that's one flavor versus kind of like, yeah, how about high dose MDMA with a hit of 5-MeO DMT halfway through, right? It's kind of like, right, like you talk about inhaled experiences. Again, lots of room for changing the dose there, inhaling very small doses. Okay, it can be subtle effects, but I think a lot of the time when we think about inhaled 5-MeO DMT, we're talking about full release types of experiences, and we're talking about experiences where the person may even black out and not even remember it for 10 minutes, something like that. So I'm sort of thinking, well, again, we don't know. There's not a whole lot of data, but logically, pharmacologically, it kind of seems that you're using inhaled routes of administration or parenteral routes, insufflated injection, things like that. You're using higher doses. You're using the designer amphetamines opposed to more like traditional ritual tryptamine types of substances. Yeah, I think like you probably end up pushing the edges and pushing the boundaries, and exactly like what can a pregnant woman do and not do. It's kind of like, well, you know I've seen plenty of videos on Instagram of like pregnant women doing like headstands and yoga poses that I couldn't do in my wildest dreams without being pregnant. Right. So it's like obviously that, some people are quite capable of doing things while they're pregnant, but it's also, I think, fair to sort of think that it's a time that you want to take it easier and a time that you don't necessarily want to push the edges and do extreme physical things and stuff like that. And some of these experiences might push some of those edges.
Yeah, that makes so much sense. And I really appreciate you summarizing that and just presenting all of the evidence. Like we talked about in the beginning, whether or not you thought you were the absolute right person for aggregating this information, you were the person who did it. And we were very grateful for that, because I think a lot of people are going to, at least this gives some guidelines of what is out there. What can I moderate, right? It's not an all or nothing. Like you said, it's not, can I go do my normal full 2 cups of ayahuasca versus can I go do a quarter cup if I'm having a very uncomplicated pregnancy? Like there's a lot of nuance to this. So I really appreciate you bringing that nuance to this discussion. And your knowledge is just second to none. So appreciate that as always. Can you tell people where to find you and your work?
Yeah, of course. So spiritpharmacist.com is where I live. You can follow me on Instagram and Facebook, but honestly, like signing up through my email list for spiritpharmacist.com, you get the best of me that way. I send like a monthly clinical digest newsletter that a lot of people enjoy. Um, what else? I do consultations, right? So if you want to like talk to me like one-on-one about a situation, there's that as an option. Courses in psychedelic pharmacology, and then if you really want to work with me longitudinally, I have a member resource and support program that's a subscription. And yeah, again, if it's kind of like I want to take some courses, I want to ask some questions, maybe myself or some of my clients would like to book discounted consultations, the member resource and program like quickly becomes the best value. And again, it's the longitudinal vehicle that I have for people that want that kind of relationship with me.
Well, that's an incredible offering, and I highly recommend checking it out. We've had Ben on a million webinars. Like I said, he's a Psychedelic Medicine Association board member because he's so very generous with his knowledge. So, Ben, thank you so much for coming on the show. I really appreciate it.
Thank you so much for having me, Lynn Marie. It's always a pleasure to chat and support you, Plant Medicine Podcast, Psychedelic Medicine Association. You're doing so many great things in the world, and I'm grateful for that.
Oh, thank you, Ben. All right, for everybody else out there, until next time. Thanks so much for listening to the Psychedelic Medicine Podcast. If you enjoyed what you heard, please leave a rating or review as it helps others find the show. And if you'd like to learn more, you can find the show notes at plantmedicine.org/podcast, and there's information for clinicians at psychedelicmedicineassociation.org. Our incredible music was by the one and only Porangi. We'll see you next time.